Good morning, Louisiana. This is Attorney General Jeff Landry, joined in studio with Chief Deputy Bill Stiles and Brandon at the control board.
Yes, sir.
And we have, everybody's joining us on the Hickson Hazard Hotline. And of course, capping off just a great show. Having the Louisiana Attorney General guest host for Moongathon, you can't have a show unless you have the Attorney General, right? The Attorney General. So joining us now is Attorney General Jeff Sessions, Trump's nominee and Attorney General. General Sessions, great to have you on the Moongathon show and visiting with us here in Louisiana. How are you today?
I'm doing great, Jeff. It's good to talk to you, and thank you for your partnership and leadership in the state. We really appreciate that relationship.
Well, it's been great. I know we had dinner a couple of, 3 or 4 weeks ago when you were in New Orleans for the National Sheriff's Conference. Great. Thank you for coming down to Louisiana. You were the Attorney General in Alabama at one time. That's correct?
Yeah, I was, and United States Attorney in Mobile for 12 years, so not too far away. And really, it was a great time for me. I enjoyed that. I felt like, as I know you do, that this is a fulfilling, rewarding job. It's a tough job, but if we do it right, we make our communities safer. We affirm the rule of law, and we just protect the safety of the American citizens, and that's important.
Well, I tell you, I was looking through your bio, and I realized that at 47, there's no way I could get all of your accolades. But the only thing I've accomplished that you have accomplished is as the Attorney General of Louisiana and you as Alabama. But you've got a great, outstanding career. You're doing a great job up in Washington. And I know we talked about giving you an opportunity to talk about two great events that projects that we worked on collectively. I think all 50 states joined you in the Operation Broken Heart. And also the National Healthcare Fraud Takedown. Both of these initiatives this year were record-setting. And so I wanted to give you an opportunity to kind of talk about it and brag about it, because you should. I mean, you're upholding the rule of law, and we're helping to ensure that our communities are safe.
Look, we're going to be relentless, and as I know you are, in going against people who abuse children. These abuse cases are just stunning, and it's amazing how many there are. But we've trained as part of the Internet Crimes Against Children funding through the Office of Juvenile Justice Program of Department of Justice, the training of some 600,000 state and local officers. And in 3 months, throughout the country, state and local people have arrested over 2,000 individuals charged with abuse of children, mostly sexual abuse of children. You've been a big leader in that. I know you had a big number in Louisiana, and thank you for that. But we believe that we have to keep the pressure on. We cannot acquiesce and give in to this serious problem.
Well, look, I want to thank you, and certainly for those listening out there, because we get accolades from people all the time about the work we do in putting child predators behind bars. But I can tell you, none of that work, the team that we have here in Louisiana, would not be possible without the money that comes from your office. And so we appreciate that. And certainly for those members of Congress, I know a couple of them listen to this show as well, they should pay heed about that. I mean, because the funding we get from the U.S. Department of Justice is responsible for the ICAT unit that we have. So thank you.
Well, we're glad, and it's something that I think is important. It's working. We've had task forces in all 50 states. We've arrested 2,300 predators in just 3 months. This is a successful program. We're going to keep the pressure on. I know you feel strongly about it, as do I. And we just cannot abandon the field. We cannot allow them to use this new technology to abuse children.
Well, thank you. You're right. And another issue that is near and dear to my heart, something that we put at the top of our list is Medicaid fraud. because I believe that when you defraud these welfare programs, you're stealing from those who need it the most. These programs are set up to help Americans, to give them a hand up. And when people go in there and they abuse those systems and steal from them, it's a crime at the highest level. And of course, we joined y'all in a National Healthcare Fraud Takedown, which had outstanding results. And of course, in Louisiana, we did Medicaid expansion. Our Medicaid program seems to be ballooning. Wanted to give you an opportunity to talk about some of the things that y'all are doing to rein in that spending.
You are right. The federal government funds about 70% of Medicaid, but it is a huge expense for all of our states. And it's so important that people like yourself, like attorneys general around the country, work hard to maintain integrity in those programs. You've got individuals who lie about their income to become eligible, but you also have large medical supply companies and others that just fraudulently abuse this system, driving up costs to an incredible degree. And we've got to do better about it. It's one of the areas where we have a huge expenditure of state money and federal money. And of course, Medicare, the federal program is even larger, and it's a subject of great abuse too. And it's a big part of our projects on this healthcare fraud and opioid takedown.
General Sessions, one of the things that's these two things are kind of hand in hand, or at least we believe that the opioid problem we have in the United States is in large part funded by these people that are frauding Medicaid. A lot of the prescription drugs, we always got to remember when we're talking about the opioid problem, it was started by prescription drugs, and it's drugs that come from doctors, from pharmacists, and ultimately a lot of times from Medicaid programs and welfare programs where folks can go in there and be dishonest and disreputable about injuries they may have or may not have and get scripts and then turn around and sell them on the street.
You are so right about that. It is amazing. Since January of 17, we've charged nearly 200 doctors, and that is prescribing opioids. We've got cases where one doctor had $1 million in cash under his bed. Another case where lines were lines wound around outside the clinic where they were just writing prescriptions to get opioids. Lots of that is paid for by Medicare. A lot of it's paid by Medicaid. A lot of it is paid for by private insurance, all of which is costing the average American who's paying for this. So this is a devastating health problem in America. It leads to opioid, it leads to heroin, it leads to fentanyl, it leads to death. These addictions are powerful. We are determined to attack this opioid problem in America, and the foundation, as you suggested, starts too often with prescription to pain pills, and we just can't allow this to happen. We've seen a significant decline. The president has declared a national opioid health emergency in America. We're responding. All the agencies of government are responding. President Trump is determined to reduce the amount of these opioids that are getting into the marketplace illegally, and so are we. We may have as much as a 30% reduction. That's our goal, to have that much reduction in the prescriptions, because we are by far, as you know, the number one user of pain pills in the world. Nobody close.
Well, General, we are coming to the end, and I share with you that passion to work real hard to combat this epidemic that is killing tens of thousands of Americans and certainly impacting Louisiana as well. We appreciate the partnership that we've had with your office, and of course, we want to remind our followers they can follow General Sessions at his Twitter handle at the Justice DEP Department on Twitter. And General, thanks again for joining us. Hope to see you again soon. Thank you again for everything that you're doing for both taking child predators off the street and helping us combat our Medicaid fraud. Appreciate you taking the time out of your day today. Thank you so very much.
Great to be with you. 85% of law enforcement is state and local. You're the great leader in the state, and we enjoy working with you.
Thank you, General. All right. We are coming up to the end of the hour. We're going to have our conclusion, and our special guest is going to be me.